Yes, welcome this Saturday. Welcome this Saturday. It's good morning. Some places it's good evening. Some places, and some places it's good night. Depending on where you are. I can see Jamaican uncle, my friend. Good morning, happy Saturday. That is Grandma of Three. Welcome to the channel. Welcome to the channel. Time I don't have topics. The topics that I'm presenting are requests from people. So welcome everyone. Welcome everyone. Thank you a lot for tuning in this Saturday. A good Saturday here, and that's been at least a good day. It's not chilly this side. Good morning, happy Saturday. Yes, Jamaican uncle says good morning to you, Dr. Benjamin, and everyone in the chat. Good uncle, how are you? How have you been? Much appreciated. Today, it's a good day. It's a good Saturday. Weekends most of the time is a chilling, visiting, doing ABCD. Going somewhere. Some people decide to go to relax at home. So if you are relaxing at home, feeling nice, if you are out there feeling good with your friends, nice day. We want to talk about eye complications. Many people have complications of the eye. Very many people have complications of the eye. Complication of the eyes, and some people don't know that they have eye complications. So that is what we want to talk about today, about the eye complications in general. Eyes have so many complications. So if you are watching me right now and it's the first time you are reaching here, don't tell us from the chat, this is my first time I come from this country. Yes, because we meet so many people here from different countries, and we interact and we talk to each other. So if you are one of them from this country, that country, big up all the time. Welcome to the chat. Tell us where you are from. I'm just getting in, and the topic has not started. We're talking about the eye. You can see Onik is here. Onik, big up yourself every time. Feel good where you are. Thanks for coming in. Everyone who is coming, who is watching, and remember, if you are a new guy in the platform, give your subscription. You may get some good notifications, because when we start giving some topics, points, sometimes points and topics that help. We talk about points and topics that help other people. So be ready, be cool to be around. Stay around for some time. Don't go. Stay around. So Onik, welcome. Today we are talking about eye complications. If you are watching and you have not subscribed, please subscribe. Your subscription is good. And also tell us where you are watching this from. Which side are you watching from? Yes, we talk about medical issues here. And doctor, how are you? Onik, I'm fine. I'm very fine. Hope you are fine too, Onik, where you are. Hope you are good and doing good where you are. So those that are watching from all dimensions of the world, welcome to the platform. Welcome to the platform. Tina Marie is here. Joriam Technologies. How are you, Doc? Yes, I'm fine. Hello, Dr. Tina Marie. I can see you have already tuned in and you are doing good. Remember, if you have any medical question, just ask that medical question. We discuss any medical question. Just ask it. We talk about it. If you have a channel and you are coming here, tell us you have a channel. We follow your channel. We see how your channel is doing and what we can support in your channel. So my friends, welcome to the platform. Welcome, big up every time. I'm welcoming people before I start. You that is watching, like double tap your screen like this, it will like, or you just dial the like button. And if you have not subscribed, big up, subscribe, give me a subscription. Let's grow the channel. Let's get together and grow. No, today's topic is complications of the eye. The eye can develop many problems from diseases injuries, infections, and even diabetes. You have seen diabetes, cataracts, hypertension. As you age, you start having problems, or genetic conditions. You see, here there are some major things that we'll talk about. There are some major things here that we'll talk about the eyes, and they are just general facts. If you go to details, there are so many. This is a topic that someone had requested we talk about it. So if you are a new person and this is the first time you are watching, subscribe, subscribe and tell us on the chat. The others that are on the chat, tell them I'm here, it's my first day, and how can I respond, or how can I say something? You will be guided. So welcome to this platform. Benjamin is my name. People call me that, Benjamin. I'm Dr. Benjamin. So let's get going. If you have questions, come to the chat, ask any question. Yes, I'm doing okay, working at the moment. As your day. Now come to the chat. Tell us where you're watching from. Subscribe. Subscribe. Give me your subscription, and always promote us, but by telling us where you are and giving a like to the channel. Give a like to the channel and let's grow together. Now, common problems of the eye complications are like blindness, loss of vision that may be partial or complete. You know, blindness is not just blindness. There is partial blindness, there is complete blindness. So you may be thinking you are not having the partial blindness, you are okay, but you may be having some complete blindness. You see, good. So far, I hope you are doing well. You see, people are interacting at the chat. That is so nice. So blindness is one thing that is a problem when it comes to eye complications, and it may be partial or it may be complete blindness. So you know, blindness is loss of vision. So causes are like the causes of blindness are trauma, diabetes, glaucoma, cataracts, retinal detachment, and severe infections. So those are the things that can cause blindness on your eyes. You see. So the symptoms are progressive loss of sight and inability to recognize objects. You've seen some people that are diabetic. You may find most of the people that are diabetic, they lose sight. We're gonna see how diabetes can make you lose sight sometimes. You see, we're gonna see how diabetes can make you lose sight. Sometimes you may wonder why is the person losing sight, and it's just a diabetic person. We will get to know how it comes about. Difficulty in moving independently, because you have to be someone has to hold your hand so that you'll be pushed around, because you are seeing partially. So those cases that I've talked about, if you have any question, you can really ask about anything that you need. So we have something that is called cataracts. The cataracts. What are cataracts? I will choose some about that we can discuss. These are complications of the eye, cataract. And you know, many people here have met some people that have gone to cataract surgery. So what happens in cataracts? The first thing that we're going to talk about is cataract. What happens to cataract? A cataract is clouding of the normal eye. Clear, you see, normally clear lens of the eye, the clear lens of the eye. This cloudiness blocks the light to get in, leading to blurred vision or dim vision, because now the lens is coming cloudy. The lens is coming cloudy, so you are seeing dim things. Now, common causes of cataract, common symptoms are like blurred or cloudy visions when you have cataracts. With the lens, you know, the lens is here, and then there is there is cornea, there is the lens. So when the lens, which has aqueous humor inside, starts to have damages, you start seeing things that are dim because it is cloudy. So these are the first things you start seeing: blurred or cloudy visions, difficult to seeing in the night. At night, you start having problems. Seeing things becomes a problem, you see, at night. And then we have what? Seeing halos around. Colors appear faded or yellow. Frequent changes in glasses prescription. Aging becomes another big problem. Eye injury, trauma, and diabetes are, you see, sometimes you can, as you grow old, the lens starts to have some complications. So seeing becomes a problem. Eye injury or trauma, if the eye is injured or there is trauma. People that have diabetes, yet you've seen people that have diabetes sometimes, when sugars are so high, you start having problems to see. So tell us when, if you are here and you have ever seen a problem with difficulty in seeing or problems of the eye. Let's discuss about them. Let's help each other to know what happened or what we can do. And I welcome everyone who is in the chat. Welcome everyone. Let's continue to each other and interacting. Now, we have something that is called long-term steroid use. Steroid, prednisolone, dexamethasone, those drugs, you are using them for so long, they can bring a problem to your eyes. You start having cataracts. You see? Benjamin, Jamaican uncle, greetings, me. Hope you are doing fine wherever you are. Hope you are doing fine. Excess UV lights and smoking. Everywhere we talk about something, there must be smoking. Smoking must be there. This smoking must be a bad thing. And no, some people don't listen to themselves. They just like smoking and smoking. Nuclear cataracts. There are two types. There are types of cataracts that we have. Several types of cataracts. One is called nuclear cataracts, formed in the center of the lens. So in the lens that you have, you'll see some whitish thing that is there. Cortical cataract starts at the edge of the eye as it goes to the center. So there are several funny things that happens to someone. Posterior subcapsular cataract develops at the back of the lens and comes to the center. Happy Saturday, Dr. Benjamin. Happy Saturday, Queen CNLB. Thanks for tuning in. Here it's a Saturday and it's good Saturday. Today it's not gloomy. It is cool. Today we are feeling nice. It is cool. There is no gloominess around. These cataracts can be treated, and you've seen some people go to get surgeries when it is bad. So if you have had anyone who has a problem with cataracts, tell us. We advise you, but we will deal with the treatments. Kate is here. Welcome, Kate. Welcome to the platform. Hope you are doing good, Kate, wherever you are. Hope you are doing good. Everyone who is here, my friends, hope every person is doing good in where he is or she is. So we are talking about the complications of the eye. The first one we have talked about is clouding of the lens, causing blurred vision. Complications are progressive blindness. Falls and accidents can lead you. Falls and accidents. My friend who is Rosanna Vlogs. Rosanna Vlogs, how is the going? I'm fine, Rosanna. I'm very fine. Life with the Russells. Wow, all my friends are coming in. Remember, we have a birthday tonight. Johnny Be Good. Today we are doing Feel Good Evening. Some good songs and dedications and giving Johnny Be Good some. So don't miss, my friends, today's evening. Today gonna be hot. So Jamaican uncle, if you are listening, tell Jamaican uncle we are Tell Johnny Be Good. We are waiting for him today at the. We are waiting for Johnny Be Good today at Feel Good Evening. I know you have Johnny Be Good's number. Please communicate to him. Tell Johnny Be Good dedications today are for him today. Yeah, right with the Russells is here. Kate, I'm good, Doc. How are you? I'm very fine, Kate. It's a Saturday and we are feeling good right here. And we are pushing on. We are pushing on, and everything is a blessing. Everything is a blessing. So let's continue. We are talking about complications of the eye. Problems regarding the eye. Problems regarding the eye. So we have said there is this that is called clouding of the lens. That is cataracts. Cataracts is clouding of the lens. You here in Philippines, Jamaican uncle Rosanna is waiting for us there in Philippines. Check if you have liked, like the stream, and for the new guys who are popping in, if you have not subscribed, my friend, subscribe to this channel as we talk. Subscribe as we talk, and like the channel. You see, people are interacting at the chat. Tell us where you are watching us from. Tell us where you are watching us from. Let's interact. Let's have a big party today. Jamaican uncle, don't forget to tell this is McKenna Symptoms. Hi McKenna, welcome to the chat. Uncle, don't forget to tell Johnny Be Good we'll be waiting for him. I know you have Johnny Be Goods. Hello, how are you? I'm fine, McKenna. McKenna Symptoms. I'm very fine. Welcome. Is this your first day here? If it's your first day, McKenna, subscribe and like the stream as we go on. Welcome, McKenna, where you are. Which country are you from, McKenna? McKenna feels like a Kenyan word, a Kenyan name, but I can see you are speaking in Spanish. So tell us where you are from. Let's get to know you. Now, complications are like cataracts are progressive blindness, falls and accidents, difficulty in reading and driving. Symptoms are cloudy vision, halos around light, and poor night visions. You'll be having poor night visions when you have cataracts. We have another thing that is called glaucoma. These are problems of the eyes problem. So guys, if you are here, you are watching, check if you have subscribed and liked the video. Subscription is important, and if you subscribe, be around and watch. Don't just subscribe and disappear. We like visitors, we like talking to people, and we like you. So welcome, McKenna, Life with the Russells, Jamaican uncle, Kate Kenya, all of you, Tina Marie, Grandma of 3, Onik, and everyone who is watching. Be blessed, and let's continue growing together. Yes, check if you have liked as we welcome more people that are coming in. Welcome. Now, have you ever heard of a condition that is called glaucoma? It is condition of the eye. Glaucoma, most people that are diabetic are having this problem, glaucoma. It is a group of diseases damaging the optic nerve. The 12 cranial nerves that we talked about. Olfactory, optic, the second cranial nerve. It is called optic nerve. Usually due to increased pressure inside the eyes. Intraocular pressure. The optic nerve carries visual information to the brain. So if it is the ocular pressure, the aqueous humor is having more pressure, because as your eye, let me draw something here. I love drawing. I have drawing. So welcome, my friends, wherever you are. If you are a new guy, tell us where you're watching from. Tell us where you are watching from. I'm drawing an eye. Tell us where you are watching from. I'm drawing an eye. If you have any question which is medical and just to talk about it, Please tell us. Tell us where you want us to help you from. This one that I'm drawing is called an eye, an eyeball, an eye. So this is the eye. This is the eye, and then we have something here. The eye has aqueous humors. So this aqueous humor here is a fluid that is here inside the eyeball, and it is being filtered around these places here. So it keeps on draining and going back. So if these holes here of your eyes are blocked, the pressure inside here will be high. It's not draining the fluid, the aqueous humor. And then there is something here, the cells that are here, they'll be pushed, and you know the optic nerves comes out from here. So there is something that is called cupping. This area will be bigger and the optic nerve will be pressed. So if the area is bigger, we call it cupping. The normal size here will be more than normal, and it will be pushed. So as it is pushed, so we call it cupping. As we call it cupping, the nerve is being pushed. So that is when the integration of the image to the brain damages, because the optic nerve is the one which takes information to the brain, and you see a person, you look at a person, you see this is color white, this is color blue. Glaucoma can lead to permanent vision, because if that nerve is destroyed, all is gone. Welcome, my friends. If you have any problem of the eyes and anything that you want to ask, please ask here. Let's talk about the problems that you have, that you need to know, or you want to ask for a person. So check out if you are watching, if you have liked, give me those likes. Let's continue to like, let's continue to give those likes, let's continue to have new friends. If you are a friend watching, tell us where you are watching from. Tell us which country, which state, which area are you from. Are you from Africa? Are you from Asia? Are you from Russia? Are you from the US? Let's get to have every friend everywhere in the chat talking about these things, interacting. If you have a channel, come to the chat, tell us I have a channel. We come and see what you are doing. Yes? Now, glaucoma there are several types of glaucoma. Open angle glaucoma, it is very common. Open angle is very common. The drainage channel slowly becomes to less effective. The channels of your eyes, you know, the liquid that is inside your eyes, they usually, I'm drawing an eye, they usually drain. So the drainage channels are here. Let me show you. Beauty is here. Happy Saturday, and everyone. Happy Saturday. So these ones are this is your eye. The drainage channels are here. So the fluid drains and goes back like this. I am from Jamrock. Welcome to Jamrock. You see, the fluids come and they drain and they go back. So if these channels are blocked, this is your eye. If these channels are blocked, what will happen? This one will raise in pressure here, because more fluid is coming in and it's not going out. They drain in open angle glaucoma. Open angle glaucoma. Drainage channel slowly becomes less effective. Eye pressure is rising because there is no fluid that is going out and coming back. Usually painless. Vision loss develops so slowly without you knowing, because these channels, the drainage channels here, you see how this eye is big. This eye is very big. The drainage channels here, they drain so slowly. So these are the most important things, the drainage channel here. Onik is back. Welcome, Onik. Tell everyone, if you have not liked, please like as we go on. Yes. And if you are a new person, tell us. McKenna Simpsons was here. You remind me of Bart Simpsons, the cartoon. I really loved it when I was a kid. Now, ankylosing glaucoma. The drainage parts here suddenly blocks. The drainage part suddenly blocks, and when they suddenly blocks, what happens? That is a medical emergency, because if these areas block in your eye, they are down here. If these areas block, my friend, what you will have is an emergency. This eye can rupture because fluid is coming in instead of going and coming. Onik, hi Han. Onik, Mr. Loverman. Onik. That was Shaggy some years ago. Mr. Loverman. So instead of saying Shabarangs, that was a song by Shabarangs and Shabarangs. Mr. Loverman, Shaba. Instead of saying Shaba, we say Onik. Yes, Onik is here. Welcome, my friends. If you are here, it's your first time, tell us where you are watching from. Be part of us to the chat. Communicate. Subscribe to the channel where you are. Subscribe. So we have said glaucoma has open angle glaucoma and ankylosing glaucoma. So ankylosing glaucoma is when the drainage positions here and here that hold the lens, they suddenly close. So fluids come in. It's called aqueous humors. Here it comes in, but it doesn't go out. So if it is going like that and it's not going down, what will happen? This eye can burst, and then it can rupture everything here. You'll be totally blind. So that is a very important emergency. If you start feeling severe headache, lack of vision, and you are just there waiting for everything, you should rush away to the doctor very fast. Rush away to the doctor very fast and tell the doctor so that they can form a hole, so that drainage aqueous humor can continue draining the fluid away from here. You can rupture everything, and when it's ruptured, the optic nerve is gone. You will never see. Yes, that is a medical emergency. These are the symptoms of ankylosing glaucoma. These are the symptoms of ankylosing glaucoma. Severe pain, eye pain, and then you have red eyes, blurred vision. You are seeing blurred things. You cannot see directly. You see, those are the some of the issues. Headache, sudden headache that is pounding. You can see people holding their heads like this and doing like this. Sudden headache, nausea and vomiting, because sometimes when your optic nerve is under pressure, you can get nausea because your BPs will go up. Halos around lights. Yes, these are the symptoms that someone gets when you have ankylosing glaucoma. You can just wake up, and then maybe you've been diabetic also or hypertensive, and then you have ankylosing. The drainage parts, you find that the drainage parts are blocked. And when you find the drainage parts are blocked, what will happen? You start having problems. This is a bad sign. It's a very bad sign. So we have something. We have talked about two: open angle and ankylosing. So open angle is when the drainage is draining so slowly and it is gradually closing. The drainage, this eye, this is your eye. It has fluids that rotate inside. They are produced, they come, you see. So if they close the drainage position, you start having a problem. So open angle is slowly, progressively blocking. Ankylosing is an emergency. Sometimes you just find it is closed. Bam, it is closed. And mostly it happens to people that are between 30 to 65. Between that 30 to 45, sorry. That age, angle closure. And some people that have, thanks Queen. Queen, thanks a lot. And some people that have other diseases and you're taking several steroids. People that are arthritis positive and have gout arthritis. This is a very common problem. So my guys, if you see a person has the symptoms that I've named, let me repeat the symptoms. The symptoms are severe eye pain, red eyes, blurred vision, headaches, nausea, and sometimes feels like vomiting. And is doing like this, is holding the head like this. You see, like this. Rush to a hospital. Go and see a doctor. A doctor will rush you to an ophthalmologist and we will prick to get something that is called a drainage. My eye doctor did not explain these things to me. They only do the test and Uncle, and that's why you are my friend. I'm here right now explaining. Let's go on. Let's talk, Uncle. Let's talk about complications of the eye. Let's talk about congenital glaucoma, present at birth due to abnormal eye development. A child has been born and the eyes are not draining aqueous humor. The aqueous humor is here. See, it's not draining. It's not a draining. So we have to do an artificial drainage hole on the eye. We have secondary glaucoma like caused by eye injury. Sometimes you can get eye injury. The steroid medication. You know, people that are diabetic, how much it affects the brain when people use tobacco. Tobacco is everything. It kills your nerves. Onic, and your nerves are connected to your brain, mostly the 12th cranial nerve. Let me see if I can remember all the 12 cranial nerves. We started by olfactory nose, optic eye, oculomotor eye muscle, oculomotor eye muscle, olfactory, optic, oculomotor, trochlea. Trochlea is for another nerve for the eye muscle. Olfactory, optic, oculomotor, trochlea. Abducens. The abducens, we have the cranial number 6 is abducens, and then we go, let me give random. We go, let me start. Olfactory, optic, oculomotor, trochlea, abducens, facial, vestibulocochlear, hypoglossal. We have hypoglossal. We have this one, accessory. We have vagus nerve number 10. We have another one. We should have glossopharyngeal for the nerve, glossopharyngeal, and then we have another one. Those are 11. We have another one that I remember and tell you. All these are cranial nerves that come from your brain. All those are cranial nerves that come from your brain. So this, if you continuously take tobacco, you will have a problem because these nerves are damaged. You see, these nerves are damaged, and when these nerves are damaged, what happens? Problem become, and you start having problems everywhere. And people undergo surgery for some disease. It affects the brain. Yes, it can affect the brain if the surgeon is not doing a good work. You can get infections, you can get nerve distractions. You see, those are questions from ONIC, the very our own ONIC. Those are the 12 cranial nerves of the brain. ONIC, we have 12 cranial nerves from the brain. Let me see. There is one I forgot. I really need to know it. If you tamper with these cranial nerves, you have a problem. Olfactory, nose. Optic, eye. Oculomotor, eye movement. Trochlea, eye movement. Trigeminal nerve, yes, trigeminal, the fifth one. That one, facial expression and chewing. It comes like this: ophthalmic, facial, and mandibular branch. So it's one that comes and divides, trigeminal. And then we have said olfactory, optic, oculomotor, trochlear, trigeminal, abducens. Abducens is for eye movement, lateral rectus muscle of the eye. Facial, number 7 is facial. And then we have vestibulocochlear for the ears, balance and hearing. Glossopharyngeal number 8. Glossopharyngeal number is number 9. Glossopharyngeal is number 9. Number 10 is usually vagus. And then we have accessory for movement and shrugging of shoulders. Hypoglossal, that one is for the tongue. So if you mess up with your brain, that is onic, if you mess up with your brain, those are the things that you are messing up. You may be not able to see, you may not be able to shrug your shoulder, you may not be able to do some things. You see? So those are the problems that we encounter when you are damaging your, but now we are talking about the eye, the eye. So let's talk about, we are talking about glaucoma. Glaucoma, the early symptoms may have no sign because the pressures are slow and low at that time. As damage progresses, we may have loss of peripheral vision and tunnel visions, difficulty in seeing in dim lights because the nerve cannot perceive light as needed. But there are some people who have risk factors of glaucoma, some people that may have problems, and you have seen most of it is because of damage of the optic nerve. An optic nerve is damaged when you have pressure that is pressuring it, or disease that is coming out with destroying the nerve. So people that are over 40 years, you have this problem. You can have this problem. You should be seeing an ophthalmologist. Now, let me ask you, this is a question that I will answer at the end of the topic. What is the difference between an ophthalmologist and let me write it, and an optician? This one is for you. Difference an ophthalmologist. Difference between an ophthalmologist and an optician. Let's talk. Let's juggle up our brains. Let's get to know the difference between an ophthalmologist and an optician. Yes, ophthalmology is the study of the eye, Kate. So let's get to see the difference between an ophthalmologist and an optician. Let's get to see if people know that difference. Yes, let's get to see. Forgiveness is underrated. Hello, doctor. Today this topic is mine. I don't care. Forgiveness is underrated is saying, hello doctor, today this topic is mine. I don't care. I think forgiveness has problems with the eyes. Forgiveness, do you use spectacles? Why do you say this topic is yours? So risk factors for people who have glaucoma are African ancestry. Most people that are from the African ancestry, they are Africans. Most of them have this problem. Severe night-sightedness, long-time steroid use, those people that are arthritis positive and they have this problem. High blood pressure, because high blood pressure can cause pressure even in the eyes, and the drainage of the aqueous humor may not be well. So it may lead to pressure at the optic nerve. Diabetes, because you know high sugar levels can damage your nerves. So if high sugar levels can damage your eyes, it means even the optic nerve is not excluded. The optic nerve can be damaged. How do you know? How do you know this person has this problem? High pressure measurement. It is called tonometry. See, I've been the optometrist. I've been to the optometrist. Oh, you've just come from the optometrist. Okay. Nice. Judy is here. Hi, Judy. How are you doing, Judy Kingray? Hope you are doing fine wherever you are and wherever you are chilling from in Nairobi. Welcome to this topic of the eyes. Topic of the eyes, how we see. So, eye doctors may use things like eye pressure measurements, optic nerve examination. The optic nerve examination is when those letters that are pulled away and they have followed some letters. So you are being asked, do you see this one? No. Do you see this? Yes. Do you see this? Then they calculate, and then you are saying your vision is 6/6. Have you ever gone to an or any doctor of ophthalmology? An ophthalmologist. Anyone who has gone to an ophthalmology, please give us your test. I know you are given some letters to read that are placed somewhere. Visual finding test, that thing that I'm talking about, and OCT eye scans, and even eye scans. That is how you can get these problems. Let's not talk about the treatment right now about it. We will talk about it sometimes. That is glaucoma. Now, there are some people that have retinal detachment. Retina. You understand? You know the retina. The retina detachment is a very bad problem to some people. Retina detachment. If your retina is detached, what will happen? You won't have any clear vision. You see, you won't have any clear vision. Retina detachment is when the retina, the light sensitive layer of the back of the eye, it is at the back of the eye, pulls away from normal position. Let me place it because of unnecessary issues. Just let me draw. When you draw these things, people appreciate. When you draw them, people appreciate. There is no, if you have a student in your family that is a doctor or a health science student, tell that student that you will never go out of drawing. You will be drawing human parts every time in your exams, and in your, you see. So this is the retina, the one that I've drawn. Oh, I'm getting a call from someone. A minute. Back here we have the retina. You see. Oh, now you can hear me. Is anyone hearing me right now? Hope you can hear me right now. when you're going to driving license, they do that too. Oh, okay. Right now, my sound is back. My sound is back. Barring walking exercise, blessing souls and everyone. Thumbs up. Yes, Barry, welcome to the chat. We're talking about the eye, and everyone. Ket. I hope my sound is back. I hope my sound is back. Ket. Now, so this is the retina. This is the retina, and it can be detached. The retina can be detached, or it can separate from the eye because of low pressures inside. The aqueous humor is low. The aqueous humor is low. The fluid that is here has low pressure, so this retina detaches and falls back. You see, this red line that I've drawn, it detaches and falls back. So when it falls back, this one leads to permanent blindness if left untreated. You see, but when you start having the problem, you start having flashes of light, floaters, seeing things that are floating, curtain-like shadows. Have you ever looked at someone and then you are seeing, very important topic, Dr. Ben. Thanks a lot, Barry, walking exercise. I wish you could be in Kenya so that when you are walking in the morning, I'm with you walking. We will walk with you one day with Jamaican uncle and do a video like we are walking. Exercise in the morning, very important. And always walk in the morning when you wake up. Fast if you have not eaten. If you need it for exercise measures. You see? So tell me how your experience with tell me how your experience with seeing an ophthalmologist went. So those are called retinal detachment. Now there is something that is called diabetic retinopathy. Damage to the retina blood vessels from diabetes. You know, when you are diabetic and your blood sugars are very high, they go to damage the eye blood vessels because of high sugar levels. And you can see some people, when you look at them, you can see some white parts, some whitish parts in the eyes. So retinopathy is damage to the blood vessels of the eye. So blindness, retinal bleeding, macular edema, all those you will see. The edema, the eye itself can be. So you start having blood vision, floaters, and dark spots. If you see a person, you start seeing some floaters. You see like your eye has something. Have you ever? If I know some people have seen this. You are looking at some things and you are seeing some. It's like you are the room that you are in is having some things that are floating. Room that you are in is having like some rooms that are floating. So these are things that we have that can make your eyes to damage. Let's talk about the complications and then we will talk about how to manage them later. So macular degeneration, the eye itself has maculas inside that helps you to visualize light. Macula. Damage to the central retina. So you see, age-related macular degeneration is common. Loss of central vision, difficulty recognizing faces, and reading problems. If you start having those problems, just know the retina has a problem. Loss of central vision, difficulty recognizing faces, and reading problems. Oh, yes. Sorry about that. You see, you can have the corneal ulcer. Your cornea can have an ulcer. You know, the cornea of the eye the cornea can have an ulcer. And I usually say an ulcer is a wound. Sometimes when you tell a patient, there are some patients or some clients, when they come and they tell them this is an ulcer, they will tell you that an ulcer is in the stomach because they are used to ulcers in the stomach. So the cornea is this part here. So it can have a wound, the ulcer, and it can lead to scarring that is leading to, when you heal, you start creating scars and eye perforations. Get symptoms are severe eye pain, redness, and excess tearing. Severe eye pain, redness, and excess tearing. You see, ulcers in the eyes. I know someone is wondering how an ulcer can come in the eyes. Your eye is a tissue just like the other tissues. Let's talk about conjunctivitis complication. Conjunctivitis complication, eye infection and inflammation that can spread in severe. The eye infection, when you have this is mostly to kids. You see them when they wake up and they have flu. You see very yellow deposits on the eye, and white, yellow and white. That is telling you that this kid or this person is having an infection. He should be treated. It leads to corneal damage, chronic irritation every time your eyes are red, and spread of infections. There is something that is called Marjay, Dr. Ben, and everyone. Welcome, Marjay. Marjay, welcome to the platform. Optic neuritis. Optic neuritis is inflammation of the optic nerve. The same nerve that comes from here, the first optic nerve that comes from here and goes to the brain. The cranial nerves of the Saturday Blessings family. Shah Travels, welcome to the platform. My big sister is here. Big sis, today is on Saturday, not going to work, just chilling and enjoying, or going out and feeling good. Some of my patients are getting shots in the eye for bleeding. Nice one. They may be having these complications that we are having. But if you see someone is diabetic, or with diabetic, or someone has kidney injuries, this person might be having high pressures, and the optic nerve may be undergoing inflammation. You see, at what time? You said at 9 Kenyan time. At 9, or is it at 7? I think it is 9 Kenyan time. Shah Travels, that is the time I'll be live, so I'll be there. If it is at 9, I'll be there. That time is a good time, Kenyan time. Optic neuritis is inflammation of that nerve, the first cranial nerve, the one that makes you see this is a cup, this is a paper, this is a water. It is called optic nerve. And when it is having inflammation, we call it optic neuritis. So it comes from the eye, goes, and then it comes up here. Just like, after the olfactory nerve from the frontal cortex, there is a prefrontal cortex of your brain, and that is where there is a root for optic nerve here that arises, that enables you to see. So after olfactory, optic, we have the other nerves that helps the eye. So you see, God is a very clever one. He started by seeing and then eye movement, because from the first cranial nerve, which is optic, you go to from the first one, you smell, olfactory, you go to optic, and then eye movement, oculomotor, olfactory, optic, oculomotor, trochlear, trigeminal. You see, the first ones are those ones. Abducens facial. vestibulocochlear, and then we go to glossopharyngeal, vagus. You see, all those are the cranial nerves of your body. So as we continue, my guys, optic neuritis can lead to color blindness, because you are seeing but you are not perceiving the images well. You are seeing, but the brain is not perceiving the images well, because the nerve that is supposed to perceive the images has been damaged. There is something that is called uveitis. Hey, Savior Man is here. Thanks a lot, Savior Man, coming in. I can see today. Oh, hey, Savior Man. God bless you, Savior Man. You always surprise me with some. Let me tell you in capitals. God bless you, Savior Man. You always surprise me with dollars at times that will make you get some water. Thank you so much, Savior Man, for that. Hope Onik is here. Thank you so much for that. Wow, I love this video. Michelle Wanjiku, welcome, Michelle. Welcome, Michelle. Is it your first time here, Michelle Wanjiku? Michelle Wanjiku, is it your first time? The Onyx, thanks a lot for token. Thanks a lot for that token. So Michelle, thanks. We are talking about the complications of the eye. Welcome, Michelle, and subscribe. And if you have a channel also, Michelle, tell the people that are here on the channel, tell them what you do. So hope you have subscribed and double tapped the screen. So welcome everyone, welcome our new friend to the channel. Welcome our new friend Michelle to the channel. Now we have cute Jessie. Cute Jessie. Hope cute Jessie, you are not going to miss Feel Good Friday today. Feel Good Friday today, we will be having someone. I've been told there is one of our person who is having a birthday, and we shall do something to him. A very great deal today at 9. So everyone who is watching, and Jamaican uncle, please don't fail to tell Johnny Be Good we are waiting for him at Feel Good Friday today. Feel Good Friday today, and we shall do a great deal. Savior Man, blessings. Welcome to the family, Michelle. Yes, welcome, Michelle. Michelle, where she is, to feel free and sit. And sit. Now, uveitis. What is uveitis? Now, this is Savior Man. You have given me $9 and you are not chatting. Tell us where you are. Oh, Savior Man has come. Mam Shah, happy weekend to you and your family. Very important. Thank you so much for telling Shah happy weekend. Shah, be blessed and have happy weekend. Not going to work today. Today is Good Friday. No, it is Feel Good Evening. Cute Jessie, it is Feel Good Evening. We usually have it at 9 Kenyan time. So today I've been told it's a great dedication to someone. Let's see how it will go. You'll be there, you request Shah still in bed. Shah is still feeling nice in bed. Hope it's not so cold where you are right now, Shah Travels. Hope it is cool. Michelle Wanjiku has said, Mimi, welcome, Michelle. I'm from Kenya. Yes, Wanjiku is from Kenya. Maybe you are in Nairobi, Kiambu, Western, Eldoret. Tell us where you're coming from Kenya. Savior Man from USA here. Onik, Savior Man is here. Onik, I told Savior Man to bring us Fiona. And I requested Fiona to be here. But Fiona thinks she's having ups and downs of works and what? No, Nyanyuki. Okay, Michelle, I'm from Nairobi. Right now, I'm at Bypass, Ruiru, named after KU. That is in Kiambu. Michelle, karibu sana dada. Welcome. You see, Shah Travel has started being a Kenyan slowly by slowly. Yani pole pole. Shah Travels is speaking in Swahili today. Hi, how are you? Chat Travels, by the time you are coming to Kenya, you'll be speaking fluent Swahili. Onik from Armenia, thanks a lot for support, and that is a big thing. I'm really waiting when I meet my friend Xavier Man. I'm really waiting that day. I spoke to him already, Dr. Benjamin. Thank you. Bye-bye, napenda your stream. Welcome, Michelle Wanjiku. Thank you for tuning in. Be coming back and we relate. Let's continue about you are all my family, Kakaben. Thank you so much, Chat Travel. Let's talk about uveitis. What is uveitis? Uveitis is inflammation of the inside of the eye. The inflammation of the inside of the eye. Complications are cataracts, glaucoma, retina swelling, and blindness. Sometimes a person can get blindness. You see? So, dry eye syndrome is another problem. Dry eye syndrome. You just have an eye that is dry. It is called dry eye syndrome. Poor tears production or excessive tear evaporation. Dry eye syndrome. What is dry eye syndrome? Corneal injury, eye infections, and chronic discomforts. You are always you have seen some people are given pressure of the eye. Yes, dry eye syndrome, it leads to pressure of the eye, and then the aqua humus is not coming out, so you don't have the lubricant. So you start having, you see, glaucoma is the one that you have pressure of the eye and it leads to optic nerve, optic neuritis, optic nerve damage. You see, so that is called glaucoma. And we have open angle glaucoma and closed angle glaucoma. Open angle glaucoma is where the angle of here is, glaucoma can also lead to blindness if you don't get treated. Yes, because it will put high pressures and then the eye will be pushed behind and the optic nerve will be damaged. So it will lead you to have blindness. You get? So open angle glaucoma is that drainage hole is partially closed and it's draining slowly. But closed angle glaucoma is an emergency. Sudden closing, excessive pain. You get? I know all about that. I was an optician for 16 years. Oh, now, you see we have an optician for 16 years. So we have to generate a drainage hole so that the aqueous humor can continue doing what? Draining and draining. Now let's see about eye hemorrhages. And remember, we have talked about the cupping here. So if the cupping is wrong, because of high pressure, you will not be able to perceive images well. I think the cupping size should be around 0 to 0.25 or 0.24, something of sort, so that you can perceive images and light well. You see, now eye hemorrhage, bleeding inside the eye, vision obstructions, retinal damage, and increased, correct, Dr. Ben. Okay, nice. Increased eye pressure, cause trauma, diabetes, and hypertension. You see, Chat Travels is Chat Travels. We have asked a question: what is the difference between an ophthalmologist and an optician? That is a question that I've asked. Dr. Ben, do you recommend glasses or lenses? I'm not the one who recommends. It is your problem which directs you to even those glasses. You can be short-sighted or long-sighted. The image is falling behind, or the image is falling in front. It's not getting to the retinal position here. I'm an ophthalmologist is a doctor that treats your eyes, can do eye surgery. Yes, that is an ophthalmologist. That is ophthalmologist. That is an ophthalmologist. Let's talk about strabismus. Strabismus, misalignment of the eye. What are strabismus? Misalignment of the eyes, double vision, lazy eye, amblyopia. Your eyes are like this, and poor depth perception. Double vision, you are having lazy eyes, your eyes that are, you are visualizing things and poor depth perception. That is called strabismus, misalignment of the eye. And these things are blocked by your I've said your brain has nerves, and this after the olfactory nerve of the nose, we have optic for vision. We have the first ones. Xavier Man, depends with the situation. Yes. What about optician? Is the someone who prescribes glasses or what? Yes, that's what we'll answer to the same. Let people give us the ideas. We have olfactory, optic, oculomotor, you see, trochlea, trigeminal. So optic, olfactory, optic, oculomotor, and the three are for the eye muscles. And so if you see something like amblyopia, lazy eyes, reducing eye movement, you know permanent reduce of vision is intact. There is a situation whereby the actions of people do not affect the brain. Is there is a situation, so that is a question from Onik. Is there a situation whereby action of the people do not affect the brain? Yes, there are so many things that can do. Eye trauma. Let's talk about eye trauma. Retinal detachment, bleeding, infections, permanent blindness. All those are problems of the eyes. Let's talk about systemic disease that can cause these eyes. I've talked about several things that are problems of the eyes. Eye trauma, amblyopia, lazy eyes, maybe your muscles and nerves have problems, eye hemorrhage, dry eye syndrome, and optic neuritis, including conjunctivitis, in fact, inflammation of the optic nerve, corneal ulcer, macular degeneration, and diabetic neuropathy, retinal detachment, glaucoma, and cataracts. All those I've talked about. That's what I did before I moved to Florida, San Xavier Man. Okay, nice one. Uveitis, inflammation. Now we talk about systemic disease that can cause complications. Spend mean the one who makes the class for or what? Spend. What are you saying, Xavier Man? That one, spend mean the one who makes. Okay, there are some diseases that you can have, and those diseases can lead you to have problems in your eyes. We have talked about diabetes, and diabetes has come with diabetic neuropathy. We have talked about cataracts. You have seen how they come. We have seen glaucoma, problem with drainage. Cataracts come because of the problem with the vessels around the eyes. We have talked about them, blood vessels. You see, now glaucoma, drainage, open angle and closed angle. I'll talk about hypertension. Yes, optician is a person that dispenses glasses, contact lens fitting. Very nice. You see, you are getting the answer straight. Let's talk of autoimmune diseases like lupus, rheumatoid arthritis, multiple sclerosis that can cause problems. And we saw multiple sclerosis are funny cells from the plasma of the blood. They become mutated and they go back to the bone marrow. You start producing some problematic cells that can end up even destroying your eyes. We brushed against it yesterday night. Between glasses or lenses, which one is better? Both of them, they do the same thing. Savior Man. Or Savior Man, are you asking about the lenses you attach on the eyes? Contact lens. They are called contact lens. Contact lens. Both of them, they do the same thing. But with they both do the same thing, but depends on the person. Yes, it depends on the person. One, finances. Two, with contact lens, Savior Man, if your sanitation is poor, you will be having problems every time. Eye infections. So you should be, yes, contact lenses. You should be careful with contact lenses. So many people like the glasses. Why? Because they have no every time putting, it's a contact. You should be having high level of sanitation. Autoimmune diseases like lupus, rheumatoid arthritis, multiple sclerosis, those are diseases that can make you have eye problem. I wear glasses, no contacts for me. Yes, some people don't like them. They find them irritating. And some people, when they have them, they get recurrent infections. So it depends with the person. So if you have arthritis, you have multiple sclerosis, you have lupus, rheumatoid arthritis, these things may cause recurrent inflammation. And recurrent inflammation may cause uveitis, which is inflammation, optic neuritis, which is inflammation of the optic nerve, and dry eyes. You get? So autoimmune infections is the other problem that you can have. So those are the problems that people have. Queen, contact lens is not for everyone, and it also depends on the prescription. Yes, Sha, please help me there. It's not for everyone, and also it depends with the prescription. But there are some people who like them. They may push for the contact lens, and they may end up using a lot of money so that they can get the contact lenses. So you give what people need. Yes, it's my choice. Good. I think at times for me, I tend to prefer the spectacles rather than contact lenses. I've seen some problems with contact lenses. People's heart stop, but their brain still continues to function. Yes, Onik, that is normal. When people's heart stop and the brain is still continuing, a person is considered dead when the brain has gone. But the heart can stop, and then we jack it up, we still continue to live. I wanted contact lenses, but because my prescription was so different, in each eye, I had to go with glasses. Oh, okay. Nice one. That's nice. So what are the warning signs, and what are the warning signs requiring urgent medical attention? Warning signs that require urgent medical attention. Sudden blindness, you are just there seated, and then you have closed angle glaucoma. You start feeling you're not seeing. You should be rushed to a hospital to get a hole so that the aqueous humor can continue draining. Severe eye pain, flashes or floaters every time, eye injury, sudden double vision, chemical exposure to eye, and sudden swelling, redness with fever. Sometimes you have seen people that have fever until their eyes starts to be dark and red. You should visit the doctor very fast. Those are signs of inflammation, like optic neuritis, and optic neuritis can lead to blindness. Those are signs of uveitis. Uveitis can lead to damage if not treated well. high pressures can lead to high capping levels, and then you don't start to see. Now, as we talk, anyone with any question that you have, any question from anyone who has any question, or you have not understood anything. Hey, sometimes you can have you can be understanding, but you are confused at the moment. Dr. Ben, glasses prescription cost a lot here in US, and it can break any time or can be lost. Yes, even here in Kenya, Xavier man, glasses are very expensive everywhere, and you have seen the glasses. What is it? The frames? The frames are very expensive. Depends with your pocket. You see, it depends with your pocket. So sometimes people that are prescribed eye glasses, some of them cannot even afford them. What happens to people's brain when they are unconscious, when they are in coma, let's say? Onik is asking what happens to people's eyes when they are in a coma or they are unconscious. That is brain injury, Onik. You cannot perceive anything because your nerves are not getting, the 12 cranial nerves are not getting oxygen, and they cannot perceive anything. When someone is unconscious or in a coma, but there is a time where in a coma, there are some things you can perceive. Miriam, welcome to the channel. To be awake and awake, the brain needs two main things to work: brainstem and cerebral cortex. The cerebral cortex in the brain, it gives you awareness, you get thinking and perception, and brainstem, the reticular activity system, keeps you awake. So if you are in a coma, it means they are not working correctly, or they are hypoxic. But hypoxia, lack of oxygen, means it should be within some time, because if you are in a coma because the brain has lacked oxygen, the brain itself can die. But when someone is unconscious and is in a coma, that means it's a period of time. The brain is not off. It is still working, but much reduced and disorganized level of activities that is no longer sufficient for awareness. It means the brain, the 12 nerves, the 12 nerves that are perceiving and producing the everything that and producing, let me use like the optic nerve. It is producing some attachments to the perception of images and light. So you have deprived the brain the neurotransmitters, so they are not transmitting the normal ways. It is reduced. So when the neurotransmitters are reduced, the brain will not die. It is being given oxygen by the blood vessels, but all the neurotransmitters and the activity of the brain is slowed down. So you go in a coma. So Onik has asked what happens to the people's brain when they are unconscious, when they are in a coma, let's say, unconscious in a coma. Two things: lack of oxygen, which should be acute. If you have gone to a coma because the brain is not getting enough oxygen, there will be a problem after some time. But coma, it means the brain is receiving oxygen, but much reduced, disorganized level of activities and neurotransmitters at a very low level, because your brain depends on neurotransmitters and interaction to the nerves, the 12 cranial nerves, to keep you aware of what is happening. I think I'm explaining. Someone is getting something, eh? Because the brainstem keeps you awake, and you know, if the brainstem is dead, Onik, are you getting me? I know you are translating using Google. Hope you are getting me well. Eh? What keeps you awake is the brainstem. What keeps you? I'm looking for something. Just a minute. What keeps someone awake is the brainstem. You see, and the brainstem is the midbrain, the pons down, and the medulla oblongata. The medulla oblongata, most vital part of survival. What does it do? Controls breathing, heart rate, blood pressure, swallowing, and cough reflex. The medulla oblongata. So if it means the neurotransmitters and the control of the medullary oblongata is down, the transmission of the is down, it means the brain will not die because the blood vessels are still giving nutrients and oxygen, but you will not wake up. Onik, are you understanding? Are you understanding, Onik? We have another place, the brainstem, which is the pons, which helps you to breathe, gives you the breathing rhythm. So people that are conscious, you may see their breathing may be slow, or go and look at a person who is at a coma. The breathing and the pressure of breathing may be so slow. It may not be hitting like normal. This person might be intubated. Intubation means that this person might have helped by a machine to breathe, and that's why patients that are intubated, most of them are intubated. Yes. Most of them are on what? Are intubated. It's not scary. It's not scary. So if you are in a coma, you are intubated, we are helping you to get oxygen and nutrients until that time that your brain will continue the normal functions. We give it oxygen and nutrients, giving oxygen, intubation, and we wait until the neurotransmitters and the rhythm starts taking place at its own. But you know, unconscious it means acute, something that is acute. This is a very serious question Onik has asked, because it is talking about stroke. So in unconsciousness, partial loss of oxygen, and when you are okay, you start just a short time. In a coma, we intubate you to continue give you oxygen and nutrients through blood until your brain activity starts to rise up. So the midbrain controls the eye movement with the visions of auditory reflex. With help with vision and auditory reflex. Why some people don't make it during comas? Now, that's a good question, Savior Man. You are in a coma, and what we are doing is we are giving you oxygen through intubation and assisted pumping in. You know, if you look, there is something that always does this. You see? So if we are giving you that for help, and it is you stay for so long and you are not waking up. You have had some people that the family has told the doctors, just remove it because we don't see this person waking up. Some people make it in a coma. After some time, the brain signal starts to work normally. Some people don't make it. Onik, are you okay with that? Are you okay with that, what I've explained? Have you okay? What now you are understanding what coma, how people are in comas and how people are unconscious, the difference, coma and unconscious. Hope you have Dorothy, hi, welcome. We have been talking about eye problems. So another question from anyone, and a question from everyone before I go to prevention and warning signs. Anyone before I go prevention and warning signs? Onik has asked a very serious question, and who is he? And Savior Man is starting to become worried. Savior Man, don't worry about it. It's good to know. It's good to know these things so that you can be in a position to help a person. In a position to help a person one day. See, so these are the blood. Sorry. These are the blood vessels of your eye. These ones here. So unconsciousness means these blood vessels are not getting enough blood to your brain. But when it comes to coma, it means we are assisting you to get the blood and nutrients to your brain, but the problem is the brain activity. I don't like to see people in the hospital. You see, no, these ones are them. These ones. I've heard the word coma a lot. I was just curious about what happens brain during coma. Yes, that is what happens. The brain, look at it as I come. Look at that as I come. Boom, 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 boom. Smiler in the city. Welcome, welcome, Smiler in the city. That question has made some people to worry a bit. No worries, no worries. It's a good Smiler. How Betty, welcome, Betty. Jesse, I'm no joke, Onik and Fiona. Let me get back here. Dorothy, glad to see you. I'm doing good. Smile in the city. Big up all the time. Smile in the city. And Onik is saying, Jesse, I'm no joke. Onik and Fiona. We really need to find this Fiona. I've tried to bring Fiona here, and it's a big challenge. But I'll bring Fiona here. I want everyone to know Fiona. Smile in the city. How are you doing? From Jesse. Doc, what causes slight redness in the sclera? That is called uveitis. Sometimes when you have, what is it called? When you have, you are reacting to some dust, you are reacting to some smoke, blood vessels dilate, and they bring more blood to your eyes. That's why you see redness, reaction of histamine. Savior man, Fiona is from Uganda, not Kenya. She is a Ugandan lady. Fiona is a Ugandan lady, the one that Onik is up and above from. So Maje, that is inflammation. Beauty, when will you come to visit me? Beauty, when are you going to visit Dorothy? Dorothy. Yes, Dorothy said you visit her. Beauty. Now, inflammation causes more blood to go within where there is a problem. So when you have some irritation of the eye due to some smoke, cloud, dust, you get irritations, you get inflammation. And when there is inflammation, more blood goes to your eye to deal with the problem, to release the mediators of inflammation. So you see, your eyes becomes red because this eye has more blood vessels around here. They have more blood vessels around here. You see? Yes. Savior man, today we are doing something. Hope you will not miss. Hope you will not miss at 9. We will be doing something. So any questions from anyone? Any questions from anyone concerning any question concerning what we are talking about, the eye? Hi, do you remember me? Goat, I remember you always. The goats always ask me that question. Do you remember me? I tell the goats always. I remember you, the goats. I remember everyone that is here. Hi, do you? Yes. I will, with God's grace. Now, let's talk about warning signs requiring urgent medical attention. Warning signs requiring urgent medical attention. Seek immediate care if someone has sudden blindness. And we have said sudden blindness might be caused by closed-angle glaucoma, severe eye pain, and flashes of floaters in your eyes. Flashes of floaters in your eyes. Yesterday the live was good. Oh, yes. The goats, hope you'll be back after 2 hours, after 9. Let me give at the goats. Beauty, are you in Oman too? No, Beauty is in South Africa. Beauty is in South Africa. Beauty is in South Africa. Beauty is a South African in South Africa. Beauty should start visiting. Beauty is a very famous girl from South Africa. And Beauty, as famous as she is, she's not very active on her channel. Now Beauty, you need to start to be active on your channel. Youth Jesse from Saudi Arabia. Yes. Now when you see sudden blindness, severe eye pain, flash or floaters, eye injury, kindly subscribe and like. Yeah. Cute Jesse always says kindly subscribe and like. Also the last name is active. This sister of man who is on Oman. Cute Jesse, where are you coming back to Kenya? When are you coming back to Kenya, Jesse? Tell me when you're coming back here. We talk. Flashes of floaters. Boss Chwea from Qatar. Is Chwea here? No, today I've not seen Chwea. You know, it's a Saturday. A Saturday, people have plans, Savior Man. People have more plans on Saturdays. So, you may not see some people here. Yeah? You understand? Eye injury, sudden double vision, chemical exposure to the eye, sudden swelling, redness with fever. Fever means infection. So if you see sudden redness with a fever all over your body, go to a doctor. You may see some, you may be given some medication. Preventions of eye complications. How do we prevent eye complications? Regular eye checkup. Boss Chwea is busy doing content like Jamaican Uncle. Inshallah this year. Oh, nice one. When you come, I'll see you. Savior Man, greet me, Chwea. Chwea is in Qatar doing some content. And you know it's a Saturday. A Saturday when people are not at work. That is the time they have to go and do some contents out there. Now, avoid smoking. Proper contact lens hygiene. You see, I've talked about contact lenses. If you don't have good hygiene with your contact lens, you have a problem. Early treatment of infections. Very important. So, my guys, Beauty is laughing. My guys, you guy, my guy. Anyone with a question, let's go. Anyone with a question? And you come with cards tonight. You come with cards because today we are doing feel good evening. Savior Man, you all have locations and schedules of all people. Savior Man has the schedules and locations of everyone. Savior Man is a big man. I call him big man because I know he knows how to plan everything. He knows how to plan. And we respond to Savior Man every time. So anyone with any question today, anyone who feels has a question, even not in eyes, any medical question like Onic, you know Onic, and even look, if you have not subscribed, Savior Man is in Michigan. Yes, Savior Man is in Michigan. If you have not subscribed and check, Savior Man is a vibe always. Savior Man and Onic, those two people, I wish they were around where I can just walk or drive to. Savior Man and Onic. Every weekend we could be seeing each other, but now you are miles away. You are very many miles away. You see, you are miles away. It's like Jamaican uncle. Like Jamaican uncle. So guys, any question as we talk, a weekend is a good day, and a good day, a good day is when people are chilling at home with family, and you see Uncle is still around listening. Uncle will always shield me and every time be with me. Savior Man, you imagine if you could be a walk away. I'm looking for something here. Yes, this one. A walk away. I will be coming to visit you every evening or calling you, we meet somewhere. If you like nyama choma, like in Kenya, we have something. I'm eating man. Oh, double tap on your screen, guys, if you are using your phone. And the other one is Smiler in the City. Smiler in the City is a cool guy. A cool guy who doesn't talk a lot. He likes talking so slowly with facts. Savior Man. Savior Man is that guy. Savior Man is that guy. I'm looking for something here and I'm not seeing it. I'm seeing my own things. Okay. Yes. Any question from anyone? Jamaican uncle wants to go to a meeting. Jamaican uncle wants to go to a meeting, a graduation ceremony, I think. And you don't. I think people don't have questions. So in the evening, we're gonna do our Feel Good Friday. Not Feel Good Evening. Feel Good Evening will be here in the evening, and we're gonna be doing such kind of things like these ones, like what I'm playing. You come with your request and your birthday wishes in the evening. This one.
I gotta be honest.
We're gonna be doing such kind of things, and requests should come. I'm back, doctor. The Wi-Fi was bad, but questions. Okay, which question did you ask? Forgiveness is underrated. Let me see. Forgiveness in the. Okay, I'm not seeing your question. Forgiveness in the underrated, but I'm saying in the evening we will do.
Be honest.
Straight from my heart, I know you believe me. Onik, are you still here? I went to optometrist and he checked my eyes. Okay, what was the problem? Forgiveness is underrated. Onik, is Onik here? Onik, you should sing this song for your lady, Fiona. This one.
I gotta be honest.
What part? This one is a dedication for Onik. Going towards who? It's going towards Fiona in Uganda. You make sure, everyone, make sure Fiona is here in the evening. Onik, this birthday we'll sing to Fiona. That song says straight from my heart. So Onik, are you still here? Where is Onik? Onik, in the evening, make sure you dedicate that song to your girlfriend, Fiona from Uganda, and we will be doing some ABCDs in today's evening show. You see, you gotta be honest. When you tell your empress something, you gotta be honest. Listen to how Jakiwa said. Unfortunately, I saw the sun at the sunset and the sun was beaming, and for a moment I got after image from the sun. I ignored it when it was still with me the next day. Oh, that one, you are creating open glaucoma or cataract. That one was open angle glaucoma coming. Let the birthday come over here. We wish you all. Thank you for information, Hosea. My people destroyed due to lack of knowledge. We need to know so that we can do. Yes, Queen. So let the birthday come and we shall do it. So unfortunately, forgiveness is underrated. Hope your doctor gave you some antibiotics for the eye. And look, Dr. Be Good, Johnny Be Good. There is a song that sings about Johnny Be Good. Let me get Johnny Be Good. today evening we're gonna talk to Johnny B. Good. I'm being reminded it is Johnny B. Good and Dorothy K. Are you the one who requested a song for your friend to this Saturday? Let me see. Johnny B. Good. Johnny B. Good. Peter Tosh. Peter Tosh is the one who sang Johnny B. Good. Let's see. Let's
I used to spend days just trying to find.
Let's see about Peter Tosh. But today, our friend Onik will be singing this to the girlfriend.
I gotta be honest. You're a hero, something straight from my heart.
I hope you believe me until death do us part. This love will never end. Let's go now. Listen to Peter Tosh. Peter Tosh says, go Johnny.
Deep down in Jamaica, close to Mandeville.
Listen to Peter Tosh.
There live the country.
Peter Tosh says, Johnny be good.
It's the goal.
Say,
Johnny be good tonight. Say go.
say. We will sing that one for Johnny be good. Is that Jamaica song? Peter Tosh is from Jamaica, Savior Man. He's saying Johnny be good tonight. That's why when I listen, I see Johnny be good, I start smiling. Listen, Savior Man.
He used to carry his guitar in the gun sand. Old engineer in the train that then tried for
He says, Johnny be good tonight. So Johnny will be good tonight at the Feel Good evening. Johnny will be there. Smile in the City. Make sure that we are having our Johnny be good. I have how many minutes to go? I have I have 9 minutes to go. Savior Man, you have never heard of that song? You have never heard of Johnny be good tonight from Jamaica? Yeah? Savior Man has never heard of that song. Very funny, eh? You come with your birthday wishes. You are
I said, oh, Johnny be good tonight. Yeah. Say, oh, Johnny be good.
That's why when I listen, I see Johnny be good, I start laughing. Smile in the City. Where is Johnny B? It's been a while not seen him in the chat. Johnny will be here tonight, Butte. And people have made it that he should be here. Uncle will call us. Listen to Israel vibration. For those that love Israel vibration, you'll be hearing like things like those ones. Listen that one. Until we earn a way to move from the west. Hey, until we find a way to move. Yeah. Our love for each other must be. Hey, so what about the Ruth and contest? Let me see the name here. He said I had my retina overdose solar retinopathy, where the macula is damaged but God is better. After 4 weeks it will be good. Nice. Forgiveness is underrated. You'll be good. I'm still Dr. Ben. You need to do a StreamYard with John. I need to do a StreamYard with John. Okay, let me see. But I'll try and contact Johnny be good. Let me find Uncle, and then I do StreamYard with Johnny, or Restream, or we do Restream. Cute, yes, thanks. Hey, Kate, what's up? Today you are listening to music and you are surprised. Now, any question? I have 7 minutes to go. 7 minutes to go about the eyes. Guys, my today collaboration will be cancelled due to family emergency for me. Oh no. Sha Travels, no worries. Oh. Sha Travels, no worries. Update. Update us what next. And then Uncle, I need Uncle. I need Johnny B. Good's number. I don't know if you'll sway it to my inbox. Savior Man, do you have Johnny B. Good's contact? Do you have Johnny B. Good, Savior Man, so that we can interact?
Just say it to me.
Cute Jessie, listen to your voice and my background. Cute Jessie, are you listening to your voice? Are you listening to your voice in my background? People are listening at your voice in my background. Let me fix it. A TV here is watching Johnny not Johnny B. Good, is watching Cute Jessie here. So I'm waiting for, I still have how many minutes? 5 minutes. I have Mamsha, a prayer sent to your family. Big up Savior Man for that prayer. Let Mamsha, where she is, have that. We thank you for always being with us and smiling with us always when we need you. You know, there are some people when you need them, when they are not around, you feel bad. So, Sha Travels, hope it's not a bad emergency. It's a good emergency. You know, they are good emergency. The ones that you listen to and you feel, this is a good emergency. So, people, 5 minutes remaining. 5 minutes remaining. Rosanna TV is back. Rosanna, at 9 we are having some good things. So, I don't know if you'll be here, Rosanna, or you'll be sleeping. Savior Man, I don't have your... Okay. Anyone who is, I'm waiting for the 4 minutes to go so that, listen. Settle down with me. I've got enough. You settle down with me. That is the prayer of Onyx. Onyx wants to settle down with Fiona. Onyx wants to settle down with Fiona from Uganda. And Fiona, I don't want to say I do. Hey. Fiona doesn't want to say I do. Fiona. Where is Fiona? We need to find Fiona. Fiona is giving Onyx headaches. Headaches. You know, let him ask Jamaican uncle. Oh, Cute Jessie, what are you talking about? Listen. I'm devoted to you. And Onyx always prays that I always prays that Fiona can say that. Can say. Yeah. Listen, I'm happy that I'm the one you love, straight from my heart. Yes. What do you say? I want to be with you. Man, love is a good thing, but when it wants to break you down, you'll be broken. You hold me like a baby. Listen to what people tell other people when they are falling in love. Listen to what people tell. Listen to what people say. Tell them I'm at this every day. Any objection? I met this girl on a rainy day, but without any objection. What did I do? In your eyes, that makes me realize I want to hold me like a baby. Say, keep me clean and Man. When you are in love, you lie to women. You lie to ladies. You lie to ladies when you are in love. I do. I want to be with you. Wait until this lady is with you. Now, that is what we usually do at Feel Good Evening. Hey, yes, this is what we do. We will be doing today in the evening. Today in the evening, this is what we will be doing. So be there, my friends. It is a 2-hour of birthday. Amkaris said hi. Amkaris, welcome. Welcome, even if you are coming late. I'm fine. We are just finishing, and I was giving people a taste of Feel Good Evening, Saturday evening. So be there, my friends. Be there. It will be cool vibes. And if you love reggae music, carry your playlist, because here in the Feel Good Evening we don't worry about copyright. We play the music as it is, and we enjoy, and we give some people some mental health proteins and supplements, mental health supplements. FRC is late today. FRC is late today. FRC is late today. But let me give FRC a taste of what we will be doing. What we will be doing in the evening. There are some people when you love, those people when you love, they think they feel jealousy. But you see, this is what we can tell them. This is what we can tell them. Listen, guys. Oh, what a situation I'm on myself in sin. There's nothing I can do. Hey, when people are loving each other, you are busy feeling jealousy. Listen to what Tony Rebel said to these people. In their way that I help me when I'm down. Because when they see us holding hands, and nothing together, probably thinking of making friends to run out together. Dancing with just friends. They say I'm burning my lady. Some criticize and say we are gonna easy. Oh, don't go there. Those are just friends, my friend. They are not lovers. So when I tell my sister here, hi dear, how is your morning? When I call Emphasis, how my beautiful lover friend? We are just friends. Don't pop your nose. Hey, Tony Rebel will tell you this. Listen.
I got me cousin and me auntie come check me from the nerve.
Everybody claims every guy.
One time it come and stand so unfair.
Everybody claims every guy.
We overstand it, chatty a bit. We'll never see relationship platonic. Never go beyond it, always step on it.
You don't be having chatty habits, my friend. But let's wait. Today we're gonna be hearing these songs and feeling good. We will be having our birthday boy there, and we will be feeling nice. So nice and lovely. Our time. Thanks, Dr. Benjamin calls. Love is not lied to. Uncle is still in the house and is saying love is not lied to. When I start listening to music, we can go up tonight. I have to do and prepare for the Feel Good Evening. So everyone who is watching, don't miss. It will be, let me post it here and pin it. It will be starting from 9:15. 9:15 Kenyan time. Don't miss it. Feel Good Evening. Feel good. It's time we haven't done it. Good evening. Feel Good Evening. If you love, you have to stay with that person. Yes. If you love, you have to stay with that person. Don't miss. Don't miss. I've just given you a pinch of what we'll be doing. Don't miss. Savior man, oh, coffee cakes. Now, coffee cakes has come late, but I was the topic of the day was eye complications. But what we do today, we will be doing some feel good evening. But as we always say, and always do here, we say that if Jah is standing by my side, then why should I be afraid? Listen to this tune as we are going out. Listen to this. Pull that down. Let's meet at Feel Good Evening. Happy Feel Good. Bye. Yes. Oh, let's meet. Let's meet at Feel Good Evening. Blessings, everyone. Blessings who have been here. Everyone that has participated in the problems of the eyes. Remember, 9 Kenyan time. Let's meet. Feel good. Let me arrange 1, 2, 3 things. Today is a Saturday. May you be blessed. Big up all the time. Bye.
Okay.